So like that, if you go on losing, then 300 cycles you have of ovulation.
Okay.
See, like you ovulate 14, 15 years and you finish by 40 years, means you know how much is the lifespan, that many years. You ovulate every month, 12 times in a year. So 300, like cycles only. Imagine 6 million and 300. And all are finished by 40, 42 years. So they thought that now what could we do? We could not do anything. But when this panacea came into their hands, this kind of treatment, they realized that if you inject this mother cell into the ovary, this mother cell will go and it will, what the dormant eggs are there and they had died down,
Yes.
it can give a new life to them and it can
Really?
make them, grow.
Wow.
It can make the granulosa cells around the egg grow, estrogens will be produced, and because of this estrogens and all, the egg which was, like almost dead there or had no function to ovulate, it will start forming.
Wow.
So now that is the whole, concept behind this PRP. You inject it once or twice. You can take the bone marrow also. Bone marrow is also very rich. Fat, your peripheral fat in the abdomen, if you take 20 ml of that fat and you process it, that also is very rich in stem cells. Of course, the pancreas, the liver, all these also has got stem cells, but we can't take from them.
Yeah.
So these are our sources: peripheral blood, bone marrow, fat cells, and they can be used in any organ of your body, but for our purpose, for the ovary. So, and the patient who was told that you cannot have a baby, your AMH level is 0.00 something like that. The AMH level increased by 87%, and these studies are a little, like new only.
Yeah.
From 2012 only they started. 2014 only they started. 16 I think. Then they had the first baby. The first baby was born in Canada to an Indian parents, and that baby's name is or something, Zen something like, that boy is around now 2 years old, 3 years old. So first baby was born in Canada to Indian parents, and of course the treatment was done there. So a new tool was there in everybody's hands. So we started using it also, and then we have had also some pregnancies with that.
So so this is a growing field then.
This is a growing field, yeah.
This is something which we will have to look out for as time goes.
There's a lot of research that is going on with relation to stem cells at both the government level as well as private research. So it's still at a nascent stage, but I think in the next 5 to 10 years we will see rapid strides in this field, which is called as regenerative medicine.
Yeah. No, I mean, it just sounds like, and it's a natural thing because you're using your own stem cells, right?
Absolutely.
So
we
you are.
use stem cells from the umbilical cord also of other people.
Okay.
Other baby, fetus
Yes.
has an umbilical cord.
Yes.
Which connects from the umbilicus
To the mother. Yes.
So nowadays we are preserving that cord.
Yes.
And fetal cells are not very immunogenic.
Okay.
Means if you take somebody's kidney, you may have a rejection.
Yeah, but not fetal cells.
But not the fetal cell, So that also they are desiccating those cells and keeping it as a store. And if you ask them,
Yes. Wow. I think it's also become a trend in some countries to preserve because you may use it for other purposes down the road.
to treat certain diseases.
Yes. Yes. Yeah. So that's what I'm saying. The technology in your space is just growing, and it can be bewildering at times. The possibilities. I'm not even going into genetics and designer babies and all that because I'm sure that's a huge topic in itself. But I'm sure mothers come to you and say, since anyway now I am doing an IVF, is it possible? Can my baby have blue eyes or whatever? I'm sure you have some mothers who ask you such questions. So.
We can say that.
So basically, that is what is called as a very advanced technology, and it is not available in India. It is called as CRISPR or gene editing.
Yes.
So we don't do that in India. In certain countries like Korea and USA, maybe they are doing, but here patients just want, if they are using a donor, they want, the baby to look as much as possible like them for social reasons. Yeah. But really, those things are still in the science fiction realm.
Really?
Coming to intelligence, make my baby super intelligent and, like a rock star, that doesn't happen in practicality.
There is this sperm bank in, I think it is in the US, and they have sperms of all the Nobel laureates, you know. And really, and the whole thing is they tell all these people with a certain intelligence level and achievement level that you are helping the world by donating your sperm, because genetically, possibly, I don't know, maybe those children will be born with a very high IQ, I don't know, but something on those lines. Yeah, is there. So I'm saying the stories coming out of this space capture the world. They capture the world's heart and mind both, because everybody wants to have a child and everybody wants to be a parent at some point in life. Actually, would we divert a little bit into pregnancy, trimesters, care, what advice you give for what kind of deliveries, cesarean or normal? Do you go into those areas, and do you give advice to all your patients on how to then, okay, now that they've conceived, then how do you carry yourself from there?
Yeah, the moment the beta HCG levels, the pregnancy test levels come positive, the journey starts. I mean, that's the time when you declare you're pregnant, and then the emotions and
celebration,
the celebration starts. So now then after that comes the day 21 of your transfer, which is where the embryo was put in. I'm talking about the journey at our place.
Yes.
I mean, because you asked us how do we
Yes.
counsel our patient. So day 21 is where the lady asks you, when can I see my baby?
Yes.
So we say you wait for 21 days, another 11 days post your test to see it on the scan. And then the 21st day is the day when we actually see it on the scan. It's placed in the uterus. It's a single sac or a twin sac, So all those, details are given on that particular day. And then a weekly scan to monitor, how the baby is growing. How is the baby's, cardiac activity, has it come on time? If they are twins, if they are separate twins, or, it's a monochorionic or a dichorionic or a diamniotic. So those things are, diagnosed on a scan. And then, probably counseling about taking the prenatals, the natal, the medication, which, the supplements, the progesterone support, So all these are very, very crucial for the first trimester, that is up to the 12th week. And then probably, if she has any issues in the first trimester, if she could, have little bleeding, then they really panic. They really get affected. Okay, I've lost my baby, That kind of, that kind of fear they develop. But then again, an ultrasound does help there, because you just, tell them, okay, everything is fine. Your babies are fine. Look at there, the heartbeats are fine. It's just that your baby is getting implanted and you have a bleed. Yeah, they might even end up in, kind of, an abortion. Some 10% of the patients
Sometimes
do undergo
I'm sure.
abortion. Yeah, then that is also very important when you counsel them. And even clinically, you are able to tell them, okay, this is a kind of abortion that you had, whether you had no heartbeat, or probably the heartbeat had come and then you aborted. So some kind of a chromosomal anomaly could have been associated with your baby. So all these things give them a kind of, reassurance that next time it should not happen, and when you treat them for the next cycle or next pregnancy, all these things are taken care of.